it's good for you. No, 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 I don't like it. Ew.
Hello everyone. We have Dr. Nisha Sundaragopal from Houston, and she was awarded by Sushmita Sen in 2019. Let's have a look at the video.
Clinical Excellence Award in Dental Medicine. Dr. Nisha is an empowered woman dentist who believes in caring for not only her patients' oral health but their overall health. She has been practicing dentistry from 2001 in two countries, in India and USA, making her a well-renowned international dentist. She is currently pursuing her master's in geriatric dentistry with USC after being mother of a teenager. That's her passion into dentistry. Her exceptional clinical skills has made her receive the Clinical Excellence Award, a prestigious from Boston University Goldman School of Dental Medicine. Dr. Nisha actively participated in supporting the community by supporting KPL charity through sports. A dentist and a model smiles and walks for charity to raise funds for hurricane-affected areas from Houston, Florida, and Kerala.
27 Investment South Empowerment Award to Dr. Nisha. Thank you very much. Well, next award.
Welcome to the show, Dr. Nisha. I see two empowered women together at the show. It was amazing. So please tell us something more about this award. We would like to know more about this, please.
Yeah, I was awarded the Clinical Excellence Award back in Boston University when I graduated in 2011.
Okay.
And so after that, I was when I submitted my application for this award, and also like I was nominated by some of the people from Houston for this award, and I was awarded this from Sushmita Sen. It was such a surprise for me.
I know, must be. Of course, she's amazing, and we are. It's like a great view to see both of you together. Like you are a role model, of course, yes, and you're doing so much for the community, being the dentist. And let's talk about your dentistry thing today. So we have so many questions again. People have been calling me. You are coming up with Dr. Nisha today, so please, we have some queries. Please ask her. I said we will definitely cover everything. So most of the people were asking us about the root canal. What is all that about? Like how it happened? What is that root canal treatment?
So whenever a patient has until no pain, there is no problem on the teeth. Like if there is a cavity, but there is no pain, there's no symptoms, then they are actually okay at that point to just get a filling. But the moment if they start feeling symptoms could be just cold sensitivity, or it could be problems of heart as well as problems pain in the night. Those are the symptoms we are actually looking for. And in case if that happens, it means that the tooth started getting into a stage of the nerve is inflamed, or like it's called pulpitis. It's like a fever of the tooth. So then the tooth starts becoming so painful, then there is no way other than to do a root canal. So root canal is basically removing the tooth root from not the root, but like inside the root. It is the nerve tissue that's causing the pain. So we remove that, and then we place an artificial filling like material, and then that is what is used for having the toothache covered.
So you basically remove the tooth from there.
Yes, yes. No. The tooth is not removed.
Okay.
The nerve inside the root, that is the one that's been removed.
Oh, okay. So how much time this procedure takes? Is it very painful? How is it?
Yeah, so it is a little longer procedure. There are specialists to do root canals. They're called the endodontists, and they are specialists and they do root canals all day long, and they are more faster. But there are some specialists, they do not take all insurances, and that happens, that leaves them with no access to any specialists. In those cases, a lot of general dentists, we help them with many major root canals. I also do molar root canals, and I've been trained in school for molar root canals, and so that just helps me to help these patients. And whereas like most general dentists, they will do the root canals on the front teeth and a little bit on the side, which are the anteriors, which are called central incisors, and then the premolar teeth, which is on the side.
Okay.
Yeah. So whenever there is pain on the tooth, most of the time it needs root canal. In simple words.
Okay, so I know it is very painful, but sometimes people do all the desi treatments also, using something in the home and they apply something. Oral gel is also there. Do you think that's the right time to go to the doctor, or they should wait, or how should it be like?
Yeah, nowadays Oragel is supposed to be not used, and it is the ADA has come up with saying that it can cause meth hemoglobinemia, or it can cause some other major issues. So try to avoid using Oragel as much as possible.
Oh, really? We
And
didn't knew about that.
yeah, so it is causing some issues. So we are trying to tell the parents, especially of the babies, not to use oral gel during teething. It is a big problem.
Okay, that is a very good information. Thank you so much for sharing this. And what about the wisdom tooth? Like usually, whenever I've seen people go to visit the doctor, they say you should remove the wisdom tooth. Does it not just imbalance, or the stability of the tooth set is not disturbed with that?
So wisdom tooth basically is so important to remove if it is bothering the other teeth. If it is on the way of developing, causing creation of a lot of crowding between the teeth, then it's better to have it removed. Or if it is doesn't have any space to come out of the mouth, then the only better way is to take the wisdom teeth out, because it can actually cause potential damage if it is in the crossway. Like this is called horizontal impaction. And when it is more goes more like if there's two teeth like this,
Okay.
and then one teeth is more like this, leaning onto it, and it's like at an angle. It's called the mesioangular, and then when it goes like this, then it says it's facing towards the jaw on this side. It's called distoangular. So it's basically angular, and those are the teeth is really obstructed, and there's no way it's going to come out in the mouth. And the earlier these teeth are removed, the safer for the patients, because the jaw is more flexible on the younger people, and the roots are not fully formed on the wisdom teeth.
Okay.
So the best time to remove the wisdom teeth is like teenagers.
Oh, really?
Yeah.
So much to be known from you, doctor. Trust me. See, education, again, I say when you have education of any subject, it really helps a lot,
Yes,
of course.
yes.
And it's so much of dedication and hard work to become a dentist. It's not easy.
And that's why these type of dental awareness shows is very helpful. And I have to thank you to make this platform available for the patients or the people audience, because awareness creates a lot of problems removed from the brain, because many a times we see that the patients have extra pain just because they are in fear, like they do not know what to do.
What to do? Of course, yes. Very
yes.
true.
Yeah.
But I should thank you for taking out time from your tight schedule and coming for the show. It's really great. So tell me, doctor, like usually like during the treatments, I have seen like a lot of people, like you have to give an injection for the numbness, right? If to do any treatment. So
Yeah.
sometimes patients they pass out, like so how you handle with those patients, and why is it happening like that?
So we usually do a thorough medical history before we start our procedure. And that is why the first few papers that give them, which is like, oh, it's a lot of paperwork.
I know it's too much.
Dental office. And
It's
some
the
patients
same
get
thing, like
angry.
you have to go in a flight and you have to go for the baggage safety and all is the same procedure, and nobody
Yeah,
likes
some
it.
patients like, they're very upset. I'm like, is this enough? Or am I giving my entire everything, all my signatures in one page or what? Like, it's yes, it's sometimes it's funny when they say that, like they say it in smiley way, because that's a lot of paperwork. But all this paperwork is very, very important, because That's how we know how to give proper care for their teeth. Because oral health is overall health, but every system is interconnected in the body. And so, like your question of passing out, so what I would do is definitely ask the patient more about the history.
Okay.
What are the triggering problems? Like,
Okay.
is it just sitting on the chair is causing him, or him or her already a dizziness of like a little anxiety? Or is it the actual injection, the ingredients of the injection that's causing the problem? Once we are able to differentiate between the pain from the anxiety, or the pain from the not the pain, like the anxiety kind of dizziness, or the dizziness from the actual injection, we need to differentiate. Once I'm able to differentiate, then if it's the first one, which is anxiousness on the chair, and I think, like, talking to them, making the atmosphere more comfortable, hearing to some nice music, soothing,
But
can reduce the
sometimes I've
anxiety.
seen people don't take care of all these things. Like they do go to the doctor, they'll just get the paper filled and they just get the patient in the room, and then later on it's a problem.
Yeah,
So,
definitely. That is why it's so important that every bit of information, it actually helps us.
yes.
So speaking about the dizziness that happens because of the injection, then there's like a lot of allergy tests that we can send them to the medical doctors. Many a times the anesthetic has an important ingredient called epinephrine,
Okay.
and it is nothing but adrenaline. Adrenaline. So, like, you have the energy shots or the adrenaline rush. So, it's the adrenaline. So, sometimes some patients, we do not use that adrenaline. That's it. Like, if they pass out on the chair, it's very important they tell us. And we would find out what's the problem, and then we remove that ingredient, whichever is causing it.
All right. Thank you so much for the information. Doctor, I've seen a lot of people, they do brush their teeth every day. They do take care twice a day. They are brushing, but still their teeth become yellow, and that looks so bad. Pale teeth, that looks very bad. So, what is the reason for that?
So yellow teeth is something most of the times patients, more than the cavities, they're like so bothered about it. Yes, I understand.
Of course.
So, so teeth whitening is a big, very big concept right now.
Uh-huh.
Uh, and we actually say that the yellowing actually happens because of the colorants from the food. Many a times, food
Okay.
colorants can cause stain in the
Oh,
mouth.
really?
Yes. So we need to make sure, like the famous thing is haldi from the desi food. Whenever I put my patients any anterior fillings, I tell them, okay, make sure get organic haldi for your food.
Oh, really? But
Yes.
tell me one thing, like in the family, if everybody, like parents and their kids are eating, but you see one of the person who's having a yellow color, why is it happening with that specific person? Because the food is the same thing, what everybody is eating, but why is happening with the specific person?
That's actually a good question. So basically, some patients, I mean, some people will have more plaque in their mouth, and the plaque can absorb more color and it can be visible more yellower. Some people tend to have less plaque. So that is why they need to make sure that they have to keep brushing regularly twice, plus use of mouthwashes. It can actually help to balance.
Okay.
Initially, the bacteria, there can be chromogenic bacteria that can absorb more color and can cause that more yellowishness or brownishness or some of those colors. But then, if you maintain the good oral balance by having a good oral hygiene, then those chromogenic bacteria, the number of them, by reducing the plaque and that bacterial colonies are reduced,
Okay.
so automatically they just go down. And some of these chromogenic bacteria, they're just forming plaque and calculus. They're not like they're the cavity causing bacteria. There are little different bacteria. Some are cavity causing, some are plaque and calculus, like the tartar causing. But basically, the brushing and good oral hygiene, regular repetitions, it can actually help and balance. Once they get the balance, then their teeth is going to naturally become like the other person. Yeah.
And recently, I've seen we do have like whitening strips and all. So you prefer that people should use that, or how is
So
it like?
as a dentist, I personally do not recommend any store brand products, especially on the teeth whitening. And majority of those teeth whitening strips, I mean, you can use one or twice, but then it shouldn't be a regular thing because they can damage it in the long run.
Oh, really?
Yes, but like there are dental specific teeth whitenings that is done in the office by a dentist that is more recommended than giving these teeth whitening strips. Like I said, it is not like a complete no-no on the whitening strips, but definitely it shouldn't be overused,
Okay.
and it has to be used with direction. So it's better to use the dentist recommended specific products, and that way you get more good teeth whitening effects, because you cannot just go and put a teeth whitener if the tooth is completely covered with tartar.
Oh,
Then
okay.
you're basically tooth whitening on a tartar deposit, not your teeth.
I see.
So when they come to a dentist, we clean the teeth
Hmm.
and we prep the teeth for the tooth whitening. Sometimes we have them pre-condition their teeth by take-home teeth whitening trays,
Okay.
and then we do the in-office tooth whitening. And there is different types of in-office tooth whitening, and there's one called Zoom, there's one called Laser.
Okay.
There's like a different types. We use some products called Boost, and that is it doesn't use any form of light or laser. It's just a chemical and it's applied in the mouth. It's an all made in America product,
Okay.
and I try to use more made in America stuff. So because we want to promote our country and
Yeah.
our country's products, and we apply them on the teeth, and then we leave it for like we provide proper isolation, because the gums and the lips and the tissues can be get affected if this bleach agent can fall onto the patient's lips or hands or fingers, because many a times I've seen patients try to touch,
Uh-huh.
and and I'm like, okay, how did this material come over there? And they'll show me the finger, and it'll be it's just very careful. So I always have somebody watch them over, and they still sometimes touch. So those are some of the things we have to be very precautious when using the teeth whitening. Yes.
So I have seen like three colors. That's white, yellow, and black also. So why does people choose turn black in color? Why is that happening?
Gande pade.
But
So
there are
it's
like 32, right? I see like one, but why is that specific one is turning black and others are okay? How
it
does
could
it
be a
work?
lot of things. If they had an old silver restoration, yes, it can become turned completely gray or black. Or if
Oh,
that teeth has a cavity, then yes, they're going to have turning black. Sometimes it's just the shade. The tooth can just naturally become more darker.
okay.
And for some reason, if we are not reaching that spot correctly while brushing, or if it is something that is a problem, then it turns into black. So you probably need to reach out to a dentist to check out why this teeth is
So
darkening
there
up.
must be some major problem happening if it is turning black. So they need to
Yes,
make sure that
sometimes.
what it is. Yeah.
Yeah. And also another important thing is trauma. If we accidentally hit ourselves and we didn't realize we hit on that tooth, it can start discoloring. So on the little kids, when they bump into things all the time, some parents come to us and say she has a gray teeth. Many a times the parents think that the gray teeth is like a dead tooth,
Okay.
not necessarily.
Mhm.
So gray tooth is just like a blood clot inside the tooth, and since the tooth is a transparent structure
Mhm.
with enamel and dentin, it
Yeah.
can actually show some grayness on there. So what we do is we try to monitor, and sometimes with time, and you would be surprised, since the blood clot inside the tooth disintegrates, and the tooth will come back to normal color on kids.
Oh wow, really?
Yes, yes. So we don't have to jump into either pulling the tooth, or, it's very important the medical provider, dental provider checks the tooth, and we call it as vitality of the tooth.
Okay.
If the tooth is not non-vital, it's like if the tooth is still alive, it's just it's hurt,
Okay.
and it has a bruise. The bruise is what's visible as a gray or a purplish gray. And we just explain to them, we monitor it, and if sometimes the color comes down, many a times I've seen that happen,
Okay.
and then we just monitor the tooth, no extra treatment necessary.
Okay.
But it's just more important that we give them the instructions, don't bite with that particular tooth, let it rest, let it heal, and then things are going to be fine.
So do you put a cap or something? What is this cap? Why do we use that? Like, you have to let us know about that also.
Yeah, so basically, when like a fractured tooth, so if we accidentally bite into a
Yes.
fork,
Yeah.
so then that's an accident that can happen. Or I had one of my cousins, he came and he said, I ate like tadka, like it went into my food and I broke my teeth. So
That's such a big
that
problem. Yeah.
simple stuff that can break your teeth. Rocky candies can break a teeth. So when it happens,
Yes.
we give them crowns. Or when there is a decay and when there is more than 20, actually more than 60% of the teeth is lost, then we give them a crown. And there's different materials of crowns. In baby tooth, since the teeth is going to fall out, we give them stainless steel crown.
Okay.
But whereas in the adult's tooth, we either go for different materials. One is called ceramic, the other one's zirconia, porcelain fused to metal. Then we have these Emax materials. So there's like different variety of materials. Each has its own value to it. In the olden days, we do like the silver crowns or the
Okay.
gold crowns.
Yes. Yeah.
This is like more out of fashion. Some people who are still fond of gold crowns,
Yeah.
gold.
I know.
So they are the ones sometimes specifically tell me, okay, I want a gold crown. And I've actually had a patient who had a gold crown in the front, who wanted a gold crown in the front with a diamond set on it.
Wow. Wow.
And some
So is
patients
it very
they
expensive? Like, is the price
yeah.
differs a lot?
Yeah, the gold crown, yes, definitely it's more expensive and it goes by today's price of the gold. And sometimes patients even ask them, we want to gold the teeth in our denture. And that's pretty interesting. So we just tell the lab that, okay, we need to put gold. And they'll say, I want two teeth, one on this side, one on that side, gold. So we give them the gold and then the stones. Yeah.
So you
There
just
are even
mentioned to me, like people want gold crown with the diamond on that, right? But what if when they're eating and they swallow it, what will happen?
it's usually set pretty good. So the diamonds they don't fall off and it's pretty secured. It's not like some of the jewelries where the open sitting, close sitting and all of
But if
that
it, ever
happens.
it goes, then what? Then what they have to do when they don't know what's
So
happening?
whenever they swallow them, like some patients swallow crowns, swallow teeth, if that
Really?
happens,
Oh my
yeah,
God.
it happens all the time. Like, like not like regularly, but it's a lot of patients that accidentally swallow their teeth. They break it and they swallow the teeth. Some people
Really?
grind. Yeah, and some people grind and they chip off things and so if they say that okay something's gone missing, something done in another country and things fell out, then all we do is we tell them to go to the doctor, like a
Okay.
medicine doctor, take a chest X-ray and an abdominal X-ray, and we're gonna locate where the crown is.
Oh
And
my God. Really?
yeah, so if it is in the lungs, there is a procedure that, if they aspirate it, then it's very important. Because I get text messages all the time. Oh, my mom swallowed her crown that was done in India. Oh,
Oh
my.
my God. Really?
So that can happen, and so we just tell them, okay, go to a doctor, take an abdominal X-ray, chest X-ray, and we will check where the location of the crown is. And most of the time, the crown's gonna come out. If not, then we have to. If it's in the lung spot, then yes, we're gonna have to reach out to the medical professional, like more specialization to actually remove the crown from there. Yes.
This shows that we should always go to a good dentist like Dr. Nisha, who can
Thank
save
you.
our life. All right, Dr. Nisha, thank you so much for the information. It was really great to have you on the show today. Thank you so much.
Thank you, Rashmi ji. Thank you so much. Yeah.